Something that once seemed so far-fetched is now possible and actually happening in today's world. Customized joint replacement, for example, a new knee designed especially for you. In this morning's Your Health Matters segment, we are joined by Dr. Barry Waldman, orthopedic surgeon with Ortho Maryland, president of medical staff at Sinai Hospital, and the director of the Center for Joint Preservation and Replacement at the Rubin Institute for Advanced Orthopedics. Good morning.
Good morning.
Okay, so what are we talking about when we say customized joint replacement? I mean, it sounds very specific.
In the past, we used to have to use off-the-shelf components for patients who are going to have a knee or hip replacement.
Okay.
With newer technology, we're now able to actually print out with a 3D printer parts that perfectly match that patient's knee.
Which obviously sounds like that's going to be better for the patient.
Yes, we believe it'll move better and will fit much better so that the patient's knee or hip acts more naturally.
So who would need that versus, I'm sure there are some patients who still would be okay with standard replacements?
There are quite a few patients that are, and it's certainly very appropriate, but almost all patients are good candidates for having a customized implant.
So what would stop someone from doing that? Is it cost prohibitive in some ways?
It does cost more money, but most insurance plans do cover it, and in many cases it's actually less expensive because we're able to use fewer instruments in the operating room and have just the things we need right there ready to go.
Okay, what is this that you have with you?
So this is actually a knee that we had made for one of our patients. It's perfectly customized to their knee. This plastic model is actually their real anatomy. And this piece that fits onto their knee is able to fit perfectly to their anatomy, and we are able to remove just the worn out cartilage without removing a lot of bone.
Okay, if this wasn't customized just for them, how closely would the repair be? How closely would the repair fit if it was just a standard piece?
We'd have a good approximation of their anatomy, but making it perfectly for their knee allows us to recreate what their knee should have looked like without their arthritis.
How long does it take for you guys to make something that is perfectly custom fit for them?
So our patients get either a CT scan or an MRI, and then it takes roughly 4 to 6 weeks to make the parts.
Okay, that's not too bad.
Not too bad.
Now, what's the recovery process for this kind of surgery?
With a partial knee like this one, we're often able to send patients home the day of the surgery.
Wow.
And they recover with physical therapy over about 6 weeks. We're also able to do this with total knee replacement, which takes about twice as long to heal.
How many more people are doing this as opposed to the standard replacements?
This is actually something that we've pioneered at Ortho Maryland. It's not available widely at this point, but I think someday most joint replacements will be done this way.
My next question was going to be, why would anybody do the standard if they could get that, but it's just not available for everyone yet?
That's exactly right.
And so how long before it is? Because you know once people hear this and know that it's out there, they're going to be calling you.
I think over the next few years this will be more and more common.
Okay. All right. Dr. Wald, thank you so much for coming in.
Thank you.
Well, Fox 45 is stepping up to make your 2011 the healthiest year yet. The Be More Healthy Expo will be held at the Baltimore Convention Center Saturday, March 12th. You can learn about exercise, eating right, and even get some health screenings. Just go to BeMoreHealthyExpo.com for more information.